No other doctor has ever said this, ever.
No.
You're never going to hear this again. Somebody just asked me right here, can you mention some of the autoimmunities? If you really want me to get specific, and then if I don't name your autoimmune disease, you're going to think it doesn't help you. I'm going to shut up right now.
Right.
But I will say that, okay, all right, is that if you have POTS, adrenals are a huge part of this.
Yeah.
If you have long haul, adrenals is a big part in this. Because if you think about it, not only does your adrenals make cortisol, which can impact blood pressure, but it also makes adrenaline. Adrenaline can really affect your cardiac function, heart rate, fight or flight. And so what you're finding is that people with POTS with these fluctuating blood pressures, huge impact because of their adrenals. But then you also think about what about people with like Raynaud's, where it's like blood vessels are like flaring or not. And it's not just Raynaud's, like blood vessels can impact upon like even migraines. Like can migraines with pressure changes or blood vessel changes be caused by fluctuations in adrenal hormones? And the answer is yes. And then the other thing too is it's like we have people with Hashimoto's. Like, well, I would like to inform all of you with Hashimoto's that you don't just have an autoimmune disease against your thyroid, which is a hormone making organ. If you have that, your body's likelihood of mistaking all other hormone making organs as a germ is 100% because they look the same. So if you have Hashimoto's, your ovarian hormones suck and your adrenal hormone patterns are going to suck.
And
So
has your endocrinologist ever mentioned that to you? I would wager to bet not.
no doctor, and no other doctor has ever said this ever
No,
in recorded history.
I believe
Okay,
it.
pay attention, everybody. You're never going to hear this again. Write it down. And
I
then,
can think of it. I can think of another condition that some people might not even realize is connected to autoimmunity, but I think also plays a role in this. And you tell
yeah,
me if what I've learned is correct. PCOS.
that is so big. It's not even funny. I could do a whole 10 lives around PCOS itself. But interestingly, polycystic ovarian syndrome is, you know, I will say it and I will be proven right later and hopefully in my lifetime. I don't care actually if I'm proven right or not because I know it's true. PCOS, polycystic ovarian syndrome,
Syndrome.
is an autoimmune disease.
Boom.
Okay. And to me, it's right up there with people who have Hashimoto's because what I find is people with Hashimoto's are a lot more likely because they'll have an attack against their ovaries to also have PCOS. The other thing is PCOS, polycystic ovarian syndrome, is also a precursor to diabetes, which is an autoimmune disease. So, what do you think PCOS is?
Right. It's like pre-diabetes, you're saying.
Yeah, exactly. And so, what I find is interesting is that people with PCOS have a very specific pattern of adrenal fatigue. I even I have letters for the shapes of these curves. So the interesting thing is you can now even look at some of these numbers and be like, not just, oh, that's all effed up. You can actually look at it and be like, she might have PCOS, or
Wow.
she has really terrible blood sugar swings throughout the day. Like she likely has some really bad blood sugar problems. She's either pre-diabetic, PCOS, or something's going on. It's like there's so much inferences. I love the fact that our alumni can look at hormones and say, "Oh, that person has fatty liver. Oh, that person likely has Hashimoto's. Oh, that person has,"
So
you
true.
know.
And yet, again, that's another one with fatty liver. No doctor has ever mentioned that before.
But what I'm seeing out there is people come to the program and they tell me what they're on. I mean, it's just freaking appalling. Last night, I think we went over, was it Sherry's result? It was Sherry's result, and she was telling me that her doctor didn't even test her hormones and told her she was going to put her on these hormones. And then she said, "Hold on, let me review these results with Dr. Maggie in the program I'm in." And the last person to have been put on those hormones would have been her.
Right. I remember.
The last person that should have been put on those hormones would have been Sherry,
And she was so
right?
smart to actually not start them because it would have caused her a world of problems.
Well, yeah, she was crazy ass, what we call estrogen dominant. Her doctor was going to give her tons of estrogen. She had progesterone that was through the roof, and she had what we call PCOS. Progesterone turns into testosterone also, and she was going to be given a shit ton of fake progesterone. And, it's so, but this is the normal care that you're getting right now. And this supposedly hormone expert, right? Like, oh, I'm the gynecologist. You're postmenopausal. I'm the hormone expert. You're going to start taking hormones, and the sooner the better, you little lady.
Yeah.
Mm.
They're not the experts, and it's to the detriment of so many people who are out there just trying to get the help that they need, and it's so frustrating. In fact, repeating labs over and over again, everything's coming out good, but they tell them the labs are fine, and
Yeah.
they know better. They know they're not.
Well, I teach people to trust the bodies, their information the bodies are giving them. And I show them the data to validate, you're right.
Right.
I'm not here to say you're stupid. I'm here to say your body is actually super smart. You're super smart and you're right.
And I have to tell you, from a client and patient perspective, that is so validating to finally have a doctor who listens to you and says, okay, we have multiple sets of data. Some of them are your actual labs and your results, but some of them are what are your symptoms? Because that's a very important data set that you pay
Bingo.
attention to, and not all doctors do. They may look at your labs and say, oh, but your labs look fine, and not even hear the fact that you say, but I'm exhausted, but I can't function, but I have
Mhm,
brain fog.
mhm.
And well, your labs are fine, so I don't know what to tell you. That's not what you do.
I've never not had the answer.
I can vouch for that.
I've never not had the answer. And I've never taken my labs are normal as the answer because that's a non-answer. Because the fact is your labs might be normal, but your this person's body and this person is telling you they're not feeling well, and there is a reason for that happening. So I always know how to get to that answer because I know what's feeding these things. I'm teaching concepts and tying things together no one else on earth really is doing, but that's hard earned from my own experience. I mean, I'm 27, I'm almost 28 years into this whole journey being a physician and all my training. And, it was hard won, but I'm so glad to be able to have turned it around for myself, but for thousands of other people. But being able to teach that now, I love it. I love that.
You're giving away free information because you care.
Yeah. And for the people that do the program, this is a master's degree in turning around your autoimmunity, period. I mean, Anne, did you expect coming into this program? You're week, I think, 9 of the program. Did you expect that it was going to be a master's degree like this where you're learning those tools?
I truly did not have any way to grasp all of that I would learn. I mean, I had no idea all of the things that I would discover about myself, my health, and just this knowledge for the future going forward, that I'm very confident whatever comes my way, I'm going to know what to do when it comes to blood work and approaching medications or supplementation, because you teach us all of it. Like you said, it's a master's degree. So, what would you recommend? I mean, you have the full program that really addresses
I
hormones,
mean,
and you also have a special hormone only program.
yeah, we have my hormone masterclass, which specifically is to address ovarian hormones and adrenal hormones. If that's what you want to commit to dealing with right now, I say join my hormone masterclass 100%. For everybody who's watching here who's interested in joining my hormone masterclass, I'm going to put a link right now in chat. You can just go to myhormonemasterclass.com and you can learn more about it. That's what I'm going to say. Number 1. Number 2, you want the whole kit and caboodle, all 5 pillars, then the time is now to book a call with our team. Okay. Don't wait till next year. When you do our interviews of our alumni, we
Mhm.
always say, if you could turn back the clock, like knowing what you know now, what's one thing you would change? And I would say universally, the most common answer we get is what?
I wish I would have met you sooner. I wish I would have done this sooner.
And I was like, I wish I had met me 20 years ago.
I
And I didn't have to earn all this. If only I could.
I know. But yeah, again, you put in all of that hard work for everybody else. And you spent what, decades, 16 plus years trying to figure this
That's what
out.
I'm
And
gonna
now
tell you.
you can teach it to us though in 8 to 10 weeks.
Well, that's what I'm saying. Like, do you want to learn it like over 15 years, like I did, and pay all the prices that I went through with it, or do you want to learn it in 2 months?
Yeah. I mean, 2 months definitely sounds better, right?
Sooner is 1,000 times better.
Yeah.
Like, I'll pay for sooner any day.